2 minutes.
Right. Hello, everybody. Let's see if we can find everyone. Get started here shortly. We're going to wait right till 10 just to. So, okay, it's 10. Welcome, everybody. My name is William from Brock IT, and I've had the pleasure of speaking with some of you. And some of you, I gather, have been voluntold to be here, so thanks for agreeing to that. So we are going to be covering some of the intricacies of PHIPA compliance. And Brock IT, we do managed services IT, and so one of the things we see within people working in the health sector, specifically long-term care, is just this whole compliance can be very confusing, and it's written by lawyers, so it's purposefully confusing and vague. So we did a seminar or a webinar on this back in October, and we got great feedback. Some of you guys may have been there or seen that. And then the feedback we got was kind of to direct it and maybe make it more pointed. So what we did is we built it out. We have now it's a 3-part series. And so today we're going to be just talking about understanding the compliance. And so it's going to be kind of 10,000 feet, what it is, what are the repercussions for not following, how does that affect your organization, and then our part 2 is going to be managing PHIPA breaches. So the essential steps for healthcare and what that process looks like. And then the third one, which I'm excited for, is preparing for the worst, which will be a PHIPA breach tabletop. So it's going to be very hands-on. We're going to get to go through what it would look like for a case study on that. So that will be something to look forward to. Yeah, Brock IT, we do that managed services, and so this is just something we've seen firsthand that it's necessary, and you can't talk about it enough to try and make sure that people are aware of the intricacies of this compliance. So I am not the expert. The expert in this today, the person that's going to be leading this, is Jonathan Bullock, who has more years than he cares to admit of experience in cybersecurity. He is the head network admin at Brock IT, and he is going to be leading us through this webinar. And so at any point, if you have questions, just drop them in the chat. I will be the moderator for the event, so I'll try to answer them. If I think it's a good one, I'll flag John and we'll talk about it. So in front of you all. And if it's not, I'll just answer it as best I can in the chat. So yeah, try and make it as interactive as I can. So if you do have questions, please don't hesitate to drop that in the chat. And there's a Q&A as well, so that will work if that's easier for you. So without any further ado, here's Jonathan.
All right. Looks like Will already put me on the screen and everything. So yeah, as Will said, it's a 3-part series. The plan here is to run, as Will said, at a 10,000 foot overview. But please ask questions as we go. If there's anything that pops to your head, we've built that in. So I'm going to be moving very quickly through slides because really we're going to be getting into nitty gritty on part 2 and part 3. But the goal is to build questions here, right? And then the hope is that if there's lots of questions, we'll be able to build those in to the next webinar, and every time we do it, make it better and better. So that way the questions are answered right in the webinar. So what we're going to be covering, the basics here is liability. So what are the fines? Because there are fines. Who's liable? We're going to be discussing vendor management. So Best example of that are your EMR providers, so the medical records providers. So PCC and Epic are the two that I'm most familiar with, but there are of course lots out there, generations, if you're not um, in long-term care, but you're in like one of those ancillary fields. And then what kind of data logging needs to be done, internal auditing of those logs, how to protect those logs, and what kind of data retention periods you have. Because of course, being healthcare, you always have the data retention periods that are very important. So jumping in, what is PHIPA? Personal Health Information Protection Act. Everybody's aware of it. And well, I would hope anyway. So getting right into that from an IT perspective, you've got your user access tracking. So basic of that is you need to track access, that so access to patient files by users, so doctors, nurses, administrative staff. You need to record specifically what patient information was accessed or viewed, and log date and time of the access for each interaction with patient data, and as well as capture any modification of that patient data, detailing the specific changes. So example with that would be, Dr. Will Thompson, he is not a doctor, but just as an example, Dr. Will Thompson accessed Jonathan Bullock's medical records on March 18th, 2025 at 10:05 a.m. And he added this note, and it just says, Jonathan hobbled his way to the bathroom. You know, that's that's an example, and that data log needs to be there and needs to be audited. And you need to know if Tracy has looked at the patient file. You need to know if Will has modified it. All of those things need to be there. So the audit trails, basically the advice I give people is that any audit logging that is available from your supplier, you should be using. Because as Will said, the legislation is very vague, and I believe it's on purpose. And it basically has a lot of, best effort and to the best of your ability and to the most possible and wording like that. So because of that, if it's available, you have to use it. Really, like that's the way it's being worded, because otherwise there's going to be an argument that you weren't doing what you were able to do. So that's so not only do you have to be able to look at a particular patient file and see everybody that touched it, everybody that viewed it, everybody blah blah blah, but you also have to be able to do from the reverse. I have to be able to look up Will and look at his user account and look at everything he has looked at, touched, done, whatever, right? So that needs to be there. All that audit logging needs to be there. You need to make sure it's secure, and you need to have reporting and breach notifications turned on. So you need to be able to generate reports for compliance checks, and you need to be doing them at set intervals. And all of those need to be policy based. So if you don't have a policy, it doesn't exist. So you need to make sure you've got written policies on what are you doing, how often are you doing it, why are you doing it, etc. Right? So that's a quick rundown. So what happens if you don't comply? Well, of course, as I alluded to earlier, there are fines. For individuals, there is a fine of $100,000 if you're found guilty of an offense under PHIPA, and that's for each offense. And then organizations, it's up to 500,000 if found guilty. However, there is also a whole subsection that's called willful breach. So if there is a willful breach, meaning, and again, I'm not a lawyer, but it seems to indicate that if there are, if you are aware of the possibility of a breach and you did nothing to prevent it, then that is a whole other thing, and there are criminal charges there. So you could end up with a criminal record, losing your license to practice medicine, etc. On top of that, there's civil liability, lawsuits. There is a very lengthy section that details exactly the way civil proceedings are to be done and how much can be done. And then, of course, you've got your reputational damage. Doesn't look good. We're all aware of hospitals being breached. It ends up in the news every single time, basically. But unfortunately, it happens so often that it falls out of the news cycle like within a couple of days. Um, and then, of course, you've got your regulatory actions. So your investigations and audits, the IPC. So they can go in and conduct an investigation, audit your organization to ensure compliance with PHIPA. Non-compliant organizations can come right in and have all kinds of corrective actions mandated by the IPC. And then, of course, you've got secondary organizations that are also requiring a certain level of compliance, like the College of Nurses as well, if you fall under that. So there's to ensure compliance, you really need to be taking a comprehensive approach. You need to have a technical as well as administrative and organizational measure in place to make sure that you're complying, because otherwise there's pretty severe penalties. So who's liable? You are. So at the end of the day, you are the custodian of the data. So as a healthcare provider, your organization is considered to be the custodian of all patient data. You collect, store, process, etc. Um, so that means you're legally responsible. Again, not a lawyer, not legal advice, but you are legally responsible for the privacy, security, and integrity of the data. So what does that mean if you have an EMR like PCC, Epic, or like Generations or whatever other provider you would be using? When you're using those third-party providers, yes, they are handling the security, but you're still accountable for it. So you need to be providing them questions. So I always recommend a questionnaire. If you Google third-party vendor questionnaire, there's all kinds of examples of them out there. Your IT department can usually go through, or if you have an MSP like ours, you can go through and create your own questionnaire that should have all the basic things that are required under PIPA and are part of best practices, and make sure that they're following those, right? These providers may provide a secure platform. Secure is a relative term. There's no such thing as a completely secure environment. It doesn't exist. So it's your responsibility to ensure that the patient data remains protected within those systems. So, and just to be clear, if you read through your terms of service with those organizations, it says right in there, it will always say right in there that they aren't responsible for any breaches that can be tied to anything to do with your user accounts. So, sharing passwords, all those kinds of things, that all falls on you. If your staff are sharing passwords, or, I've even heard situations where a nurse is, doing documentation for a round that they say they did, but it was actually another nurse. And their reasoning is that, oh, but it was my patient. Like, no, the person who did the round is the person who has to do the documentation, right? Otherwise, it's literally called fraud. So you need to be aware that that constitutes potentially a breach depending on who you're talking to. And again, I always say, I'm not a lawyer, this isn't legal advice, speak to your legal team. But but I can tell you what I've seen from an IT perspective over the years, and allowing people to document for other people or sharing usernames and passwords, it all ends badly. And it may or may not be a PIPA breach, but it absolutely will be a breach under different privacy legislation, like PIPA as an example. So if there's a data breach, your organization is who's held liable under PIPA, regardless of what third-party tools you use. You can then turn around and, of course, try and sue the other organization. But I mean, whether or not that works out for you, I have no idea. But at the end of the day, the government doesn't care who stored the data. The point is, you're the custodian of the data, so it's your fault. So like I say, you have to make sure that they're complying with your own security standards. You have to be asking for those assessments. You have to be asking the right questions. So what security compliance standards are they following? ISO 27001, SOC 2 Type 1, SOC 2 Type 2, etc. These are all really important questions to be asking your providers. And it's really important that you're asking those providers every year, because every year you need to have a fairly recent copy of that questionnaire to prove that you've done your due diligence. If you've done your due diligence, I don't see an issue. But check with your legal team, and they'll likely say the exact same thing that I did, that it's all about covering your own butt, right? If you're asking these questionnaires every year, it's going to be pretty hard to argue that you weren't trying to do your due diligence. It's not your fault that they lied on the questionnaire, right? So that falls under the third-party management, right? So you want to make sure that you're having your safeguards in place. So PIPA requires that custodians ensure a reasonable safeguard is in place to protect private health information, including using third-party services like EMR, SaaS EMRs, so like BCC, Epic, Generations, whatever. And just to be clear, I'm not picking on any of these organizations. This is just the companies that I'm most familiar with, right? So means that you have to be making sure that you're asking the SaaS provider, so SaaS, by the way, is software as a service, to demonstrate that they actually have the robust measures in place to protect the confidentiality of the data, right? So how are they tracking this data? Are they in compliance with PIPA? Because just because they're a big company doesn't mean they are in compliance with anything. There's, unless you force them to, they're not going to do something they don't have to, because it eats into their profits. So of course. So so you have to be making sure that there is data encryption standards. So that means that data is encrypted both at rest, meaning not being touched. If it's sitting on a drive somewhere in a data center, so that's what a cloud is, it's in the data center, it needs to be encrypted when it's sitting there. But it also needs to be encrypted in transit, it's called, which means the traffic from where it is to you, that path needs to be encrypted. So you need to be asking that question, because if you didn't ask, it's assumed it's not, right? So access controls, how is user authentication being done? Do you have multi-factor? Is it tied into your 365, for example? So that way you just have a unified login system where you sign into your email, it automatically signs you into PCC, Epic, Generations, whatever, right? So that's a question, right? And you have to understand what their data backup and disaster recovery capabilities are too, right? Because even outside of PIPA, you have to be asking that question, because what happens if that EMR isn't available, right? Like, what are you going to do? Do you have processes in place to be able to document on paper until you can input that data into your EMR? You need to have those in place, and you need to be asking them what their time to recovery is. What is the amount of retention that they keep on their backups? Where are the backups stored? Are they in Canada? Are they in the US? Are they in North Korea? Where are they? Right? So all of those questions need to be asked as part of your questionnaire. And then, something that's often not thought of with cloud is the physical security, because cloud isn't an amorphous thing. It's just another computer somewhere else. So that computer has to live somewhere, and it lives in a data center usually. So the question is, what is the specs of that data center? Do they have 24/7 security? Is it in Canada? Is it in the US? Is it in Europe? Where is it? So like I said, 24/7 security. Go, what kind of security? Are the people bonded? Are they vetted? Is there SOC 2? What are the standards being used in the physical security, right? So, and then of course you've got oh, I see Will just popped
I was
on.
just gonna interrupt and say, like, so for that, for us mere mortals, with limited, IT acumen, this is where you're working with your IT. And so this is where it's kind of a holistic approach. Whereas the IT is not going to be dealing with the nurses in their day to day, but their cybersecurity needs to. And so that's where there needs to be kind of a galvanization between the two. And so while you may not be able to have this conversation with your SaaS, that's where you bring in your IT and you're making those discussions together. And it's just having a policy in place so that you can follow it. And it's the yearly reviews, it's asking those things, but you just kind of have to work together, because John is speaking as an IT, which is perfect because that's what you need to know. But then for you guys who aren't dealing in so many technical terms, that's exactly where you go to your IT department and you say, hey, this is something I'm concerned about. We need to make sure we're being diligent, and then you go that way. So that's what we do for our clients, and we make sure that we're doing that. But just so you know, like, kind of tangibly where you're taking that, that's where I would say it's kind of a holistic deal between, and maybe you have IT in house or maybe you don't, but either way you need to be using your IT and taking advantage of that expertise to make sure that you are making knowledgeable decisions. So
Yeah.
I'll jump out again.
And that jumps perfectly into the contractual obligations, right? So under PIPA, you have to be making sure that your contracts and agreements provide provisions that safeguard the privacy and security of your data, right? So that's where, as Will pointed out, it's a holistic approach. It's not just the administrator of the home is looking at these contracts. The administrator of the home, like me, is not a lawyer. You need a lawyer to look at the contract, and then you need the lawyer to explain it to your IT department and to your administrator so that you guys as a whole can make a educated decision and have an educated discussion with these providers. Because what I think a lot of people think is that the contract that they give you when you sign up with one of these providers is the contract that they have. That is not the case. You go to your lawyer and you say, hey, this is their contract. I need to make sure that my required obligations are being listed in this contract. Can you confirm they are? And if they're not, add the correct provisions, right? And then they go through, they add the provisions, and they help you negotiate with the provider to make sure those provisions are in there to protect you, right? And that may or may not result in you having to pick a different provider. Depending on the size of the organization, these providers will modify small or large sections of the contract for you, um, or maybe not at all. If you're a very small home, they may not negotiate at all, but it doesn't mean you're off the hook. You still have to do that. You still have to go through, you still have to make sure you're protected, and you still have to do all those things. So um, you need to make sure that the online provider's responsibilities around reporting breaches to you, right? If there's a security incident, how are they reporting? How fast do they have to report? that needs to be in the contract legally, period. You need to ensure that data is stored in jurisdictions that comply with Canadian privacy laws. So, again, not a lawyer, you're probably not a lawyer. Check with your lawyer, make sure they're doing it right. Um, and then, of course, as I sort of mentioned earlier, what kind of standards are they following, right? So there's the NIST cybersecurity framework. There's HIPAA, which is the American standard, which, by the way, is fantastic. If you can find a provider that's fully compliant with HIPAA and provides you all those controls in Canada, absolutely take that one because those are amazing. There's CSA Star, which is the Cloud Security Alliance. That's often used by cloud environments. There's ISO 27001. There's SOC 2. There's tons of these standards out there. So you need to understand what your provider is adhering to, and if there is anything that you're sort of missing, right? PIPA specific requirements, of course, you've got your organization needs to confirm that the SaaS provider understands and supports PIPA specific requirements. So that is a discussion. Don't assume, we know what we say when they assume. So you need to make sure that all that audit logging is there. Have them show it to you. It's not enough that the sales guys say, yes, it does it. Yeah, this software will absolutely take you to the moon. Doesn't mean it's going to. You need to confirm in the meeting, show me how this audit logging works. Show me how I pull a report of who has accessed this patient file. How do I see everything that William has done? Show me those things in the sales meeting. And if they can't do it, bring somebody in that can, because you have to be asking those questions, because it's not enough for you to just say they're supposed to do it, you know. And the biggest issue is that PIPA doesn't specifically dictate which standards these providers have to follow, right? Which means that it's up to you to make sure that they're aligning their standards with the legislative requirements, which means every single home, every healthcare provider needs to be asking those questions. You need to document you've asked those questions, right? That's how you protect yourself. So now that we've gone through that, what do you need to be concerned with from an IT perspective? Well, the user tracking, what I mentioned earlier, we've got the who, what, where, and when, right? So why, by the way, is very clear. And every nurse will tell you the same thing, it's if you don't have a reason to be looking at that patient file, you shouldn't be looking at it. And you're supposed to be self-reporting if you're looking at a patient file that you're not supposed to be looking at. That's part of the College of Nurses. So the rest of it, though, falls under IT, which is that you need to track who looked at what, where it was accessed from, and when did they do it, right? So there's an explanation in the notes when you get this presentation sent out, but basically track every access to a patient file by users. So that's the who. Record what specific patient information was accessed or viewed. That's the what. Capture any modifications to patient files detailing the specific changes. That's the where. And log the time and date of access for every single interaction with the patient data. That's the when, right? So that's pretty simple. I say that, I understand it's not simple in practice, but it is simple to understand what the requirements are. So what should be audited? So, enable the audit trails to review who accessed particular patient files, provide details on the specific information that was seen, interacted with. The best ones that I've seen is where it'll provide a snapshot of what that patient file looked like at that time. Ensure that any changes or updates made to the patient records, identify any of the changes and updates, and ensure that the ability to trace back to individual users for accountability, right? Because as an example earlier, I mentioned about, if somebody's accessing a file that they're not supposed to be because there's no reason for them to be accessing that file. Well, how do you prove that, right? You need to have it in the logs, right? So how often should it be audited? So internal audits should be done by either your compliance officer, your quality control lead, somebody at the organization, at least annually, and make sure that your policies and procedures are being followed, right? So there isn't a specific date, time scale in the legislation, but when speaking with lawyers and legal experts, they've concluded that, look, the way this is worded, case law supports that means minimum annually, right? So that's end of story, needs to be done annually at a minimum, ideally more. Some organizations are doing quarterly or even semi-annually, right? So it depends on the volume of patient data and the complexity of the system, right? So build it into a policy, follow the policy. That's it. So auditing should be done by the privacy officer. So whoever that person is, or they're able to delegate that. Like, there's some organizations where the privacy officer is the administrator of the home. Administrator of the home can't be digging through logs, right? But you can delegate that and say, hey, I want to report from my IT department on this to prove that we've at least audited these. And then you document it, you put it into a documentation log, and away you go. So the data integrity. So you need to be making sure, as we're talking about these logs, they need to be immutable. So what immutable means is that they cannot be altered or tampered with in any way, meaning your IT department can't tamper them. Your EMR provider can't tamper with them. They are tamper-proof, right? So implement user authentication measures as well. So that's your limiting access. And, a good example of that would be two-factor authentication. If all you're relying on is a username and password, there's a lot of chances that people are sharing passwords. And the fact that I would bet that the majority of people in this webinar are using the same password or a variation of the exact same password across tons of different platforms. And we were just talking this morning about, whether or not LinkedIn has had their annual breach that they've had because they seem to be breached almost every year. So if you're using that password on LinkedIn as an example, then you're going to be potentially have your password out there. So, and there's services you can go online and put in an email address and look up what kind of passwords that email address is used on different websites. So that's why you want to be not sharing passwords and not reusing passwords, but more importantly, two-factor authentication. So that way there's a code or something else that, often you'll have like a little USB key like this guy, a little tiny little guy. That is your second factor, right? You've got your username, your password, and then a little USB key that you pop in, and that's how you protect the account. The next thing is, as far as permissions go, you should be defining roles and permissions clearly to limit access based on job requirements. Good example of that, it's within a lot of these EMRs, so PCC as an example, there's a financial component, and then there's, of course, patient data component. There's no reason anybody in the finance department needs to be looking at patient files. So that role, that job, should have a role associated with it that gives them access to only what they need to access. Everything outside of that, no access, right? So if you've done that properly, and then of course it's the same thing on the nursing side. There's no reason a nurse on the floor needs to have access to any of the financial data. That's an unreasonable amount of access, right? So you need to be limiting based on job roles. And I've seen a lot of organizations, I go in and I look at their EMR and they've got just a generic role that everybody has access to everything and it's the Wild West in there. You're like, this is not compliant. Well, we're doing all the logging and that kind of stuff. Doesn't matter. You've already not followed because you're not limiting access. You've already failed. Haven't even looked at anything yet, and you've already failed. So that needs to be reviewed. And then most importantly, regularly review and update those access permissions, because it's very common for a person that works on the floor, like let's say a PSW, to get their nursing degree, and all of a sudden they're a nurse, and now they might have access to more data. Or also, a person goes from being a nurse to working in, let's say, the administration side, right, as a quality control nurse or as as administrator or whatever it might be. There's no reason for them to be having the same level of access that they had before, because they're not doing any of those things anymore. They're not looking at patient files. They're not reviewing those kinds of things. So based on the job functions, you need to be limiting them. You need to be reviewing that and auditing that regularly to make sure that somebody isn't having their permissions balloon over time as they move around job roles. And then, of course, review those audit logs for compliance. I apologize for speaking very quickly. It's a lot of data, like I said, so I just want to make sure we get through as much as possible, and make sure we're covering this stuff. So please ask questions if it's unclear or I'm not enunciating correctly or something. Please, it's supposed to be as interactive as possible to make sure I'm answering your questions. So now, for reporting and breach notification, this is an incredibly important part of the Act. So when do you notify needs to be documented. This is the obligation to notify individuals, right? So you as a healthcare provider, if my healthcare data, for example, is breached, you have to have a policy and procedure in place that indicates at what point do we say this is considered a breach of their private data and we need to report to them, right? You need to have a policy that details that X amount of time, X amount of data, and you then have to say, look, after this amount of time, we're going to provide you a report of actually what was fully looked at, right? And that's where your audit logs go through, right? And that's why it's important that you check them, because if you don't check them, you haven't verified they work. And then when you do have a breach, you're going to be sitting there and looking very uncomfortable as the person says, well, what was touched? And you say, I have no idea. Just your whole patient file. Like it's not a great look. So, so you need to have when to notify, when it was accessed, used, disclosed, or stolen, all of those things. You need to have criteria for the notification. So the notification is required if there is risk of harm to the individual, which can include risks like identity theft, financial loss, or reputational harm. So we're going to do a quick question here. When do you have to report then? And if the answer that anybody gave was anything other than every single time, you are incorrect, because any amount of information about a person can be used for identity theft, financial loss, or reputational harm, right? Because just because it's not important to you doesn't mean it's not important for verifying identity, for doing whatever, right? Any private information can cause reputational harm, identity theft, or financial loss. So report every single time and you will not have any problems, because you will be covering your butt. Because if it is reported and then all of a sudden the IPC shows up and says, well, wait a second, this person has had a financial loss, and I'm looking through your logs and it says here that their data was breached, but you never notified this individual. Well, now you're on the hook, right? So I try not to give lawyers more business than they need. So they make enough money. So timeliness is the last part. So the way the act is written, it says notification to the affected individuals should be made as soon as reasonably possible after discovering the breach. So that basically means immediately, right? As soon as you know the data, you need to let them know there's been a breach. We're going to let you know how much was breached. It might be nothing, or it might be lots, but work with your lawyer to make sure you word it a little bit better than I do, because I'm a little bit blunt, obviously. Um, so content in the notification. So this is also very important. You need to have what happened, so the general nature of the breach, and you need to have what information was affected. So, log of this date, this time, etc. Um, the steps taken to mitigate the breach. So what you're going to do to make sure that this doesn't happen again or get worse, right? So if the breach, as an example, was because a user didn't have multi-factor authentication and another user knew their username and password and logged in, like a PSW, let's say, logged in using a nurse's account and checked a bunch of stuff they weren't supposed to be checking, you need to say, this is what's happened. So that's the information and what happened. And the steps I'm going to take is I'm going to implement multi-factor authentication to make sure that doesn't happen again. And we've created a policy that is a fireable offense to share passwords. That's a very common one, by the way. And in every organization should be having that. If you don't have one, you should be questioning why you don't have one. Um, and how the individual can protect themselves and to contact you for further information. So, have actual contact information in there. So whoever your privacy officer is, and possibly one of the subordinates if it's the administrator of the home, just explaining this is who you contact to get more information about this breach. The notification to the IPC should also be done. So as of October 1st, 2017, PHIPA requires that all custodians report certain types of breaches. So these are incidents that involve the theft or loss of private health information, repeated incidents of unauthorized access. So that is a great one here because that is considered like snooping. So let's say Will and Tracy are both nurses. Will is working on first floor, Tracy's working on second floor, but Tracy's aunt is on first floor. Well, she's just going to take a quick peek at first floor to see if her aunt is okay. That is considered snooping. That needs to be reported to the IPC. It should also be reported to the College of Nurses, but that needs to be reported to the IPC. And there are fines if you don't. So please make sure you're reporting them. Unauthorized disclosure of private health information due to human error or system failures is also a requirement. So, for example, you print out a patient file and you're going to come back and take a look at it. If you print it out and then you know what, you didn't get to the printer in time and somebody accidentally grabbed it, you need to report that, unfortunately. I know it sucks, but if you report it and explain exactly what happened, most likely nothing's going to happen to you, right? They're just going to say, hey, don't do that again. Hey, maybe you need to put in a code on your printer going forward. There's all kinds of suggestions that they'll give, but I've never heard of a fine being issued for something like that if you're reporting in good faith. If you do not report it and then it somehow gets reported by a whistleblower or like through a tip line or something, that I can see the IPC not taking that lightly. They're going to be upset for sure. And just to be clear, by the way, if you think the inspectors from the Ministry of Health are rough, wait until you meet an inspector from the IPC. They're not messing around. So again, the timing is that they should be notified as soon as reasonably possible. That's the wording within the act. Of course, you also have to notify the regulatory colleges. So, the College of Nurses is the best example that I always give. There's specific requirements that they will have. I'm by no means an expert on any of those, so please review what your requirements and your responsibilities are around reporting. Make sure you're doing that. So record keeping requirements, custodians must keep a record of all breaches, even if they are not reportable to the IPC or do not meet the threshold for notifying the affected individuals. So what are you keeping records of? Everything, always, all the time, right? These records have to be kept for at least 2 years. And if the IPC shows up, they have to be made available. So if the IPC shows up and they say, hey, I need a list of all your records, and you say, we haven't had any breaches in 2 years, they're not going to believe that, because every organization has minor breaches. Like our staff will tell you that I'm ridiculously OCD and overprotective with our data, but we have documented stuff all the time. I print something out and Will goes and gets to the printer before I do. That's considered a breach. I have to document it. Is there data that was actually released to the public? No, but I need to document that that happened, because if the IPC shows up and says, hey, I need a list of all your breaches, well, here are the lists. They're all just things like, me printing something out and not getting to the printer as fast as Will does. But if you show up and there's nothing, they're going to be very suspicious and then you start digging, and you don't want auditors digging, just like the Ministry of Health. You don't want them coming in and digging. So, summary. Who needs to be informed? All the affected individuals, the IPC, and your professional regulatory college. Okay. There's all kinds of information in this document about the duty to report breaches under the Ontario College of Nurses, blah, blah, blah. I'm not going to get into that. It's too detailed. It's too much. So I'm just going to jump on to the next one now. So retention and disposal of data. So you've got a retention policy. You have to, specifically, you have to have a retention policy. So a policy written somewhere that says, this is what we commit to doing, and this is how long we're going to keep data. This is how it's deleted. This is how we make sure it's scrubbed. This is how we make sure that there's no private data going out on the internet anywhere. So it doesn't specify an exact duration for retaining audit logs, but general best practice is the amount of time that you need to keep data is the amount of time you need to keep your logs, right? So because in the Long-Term Care Home Act, I can't remember the exact naming, it says you need to keep it 10 years after the last record, right? So that could be a death, or maybe they moved out, went to a different home. You need to keep those records for 10 years. That means you need to keep your logs for 10 years, right? So, going back to your SaaS provider, and questions need to be asking them, how long do the logs last? Because if it's not 10 years, you got a problem. So how do I get those logs out of your system so that I can keep them for 10 years to make sure I'm in compliance, right? There are examples, though, where you need to have retention longer than the 10 years. And specifically, it says if there are any logs or data that's involved in like a legal proceeding, investigation, or privacy complaint, that needs to be retained until the matter is resolved and for an additional period if required by legal counsel. So again, kind of follow up with your lawyers, right? You need to make sure that you have a policy in place regarding your data retention, and you need to make sure that your retention period is following that policy, right? And how are you checking to make sure it's following that policy? So that should be written in the policy as well. So every policy should have, this is what the requirement is, and then this is how we're checking to make sure that we're following that. This should be part of the policy. It's also crucial to ensure that the audit logs are accessible, but also stored securely during the retention period, because It's not acceptable to allow a just PSW on the floor to be able to pull audit logs. You need to be making sure your permissions are set up correctly in your EMR so that the people pulling logs are the people who are responsible for pulling logs, like your privacy officer or the person that they delegate to, right? Um, so you need to make sure that you're maintaining those for the acceptable amount of time, and it ensures accountability, right? So now the next part of that is destruction, right? So how do you ensure that the deleted or disposed of data records, including audit logs, uh, are being done properly when they're no longer required? So again, PIPA is great, doesn't specify any technical details or methods to actually do this. Um, However, it does mandate that the healthcare professionals take reasonable steps to protect the healthcare information, which reasonable steps would include making sure that there's no uh, stolen records, somebody isn't walking out with a banker's box full of these records. So, how do you do that? Well, you need to make sure that physical records are shredded by a vetted firm that actually does this shredding. Um, and then, of course, your digital side, data wiping. Are any records stored on your laptops? Even if you have a policy saying that you shouldn't be storing files on the laptops themselves, it's inevitable. Everybody does it. If anybody wants to verify this, just minimize this window that you're watching this in, and I guarantee you have at least one document on your desktop that shouldn't be there probably. Um, so that means that the drive, the physical drive inside the laptop, desktop, whatever it is you're using, should be destroyed. Um, so you can use software tools to overwrite it multiple times, prevent any kind of recovery. Um, or you can use a physical destruction rather, where you can shred the drives, like goes into like a steel shredding machine and it just shreds the drives up. Um, or even there's incinerators and stuff. I like to use a 20-ton press. It just turns it into a taco. Um, and then, making sure that you're decommissioning old systems and taking the drives out and keeping them so that they're not ending up in a landfill where somebody might potentially stumble upon them. Sounds crazy, but it does happen. So you really don't want to be in that. And of course, all of this needs to be in a policy, documented. So, and then, the next part is your policy development. You need to have policy procedures, outline all this uh, properly. So that's where, like I say, working with lawyers, but also working with the HR department. They're very adept at writing these policies and procedures because they're used to writing policies and procedures for other things. So you can check with them. They're usually a great resource. Um, and they need to include, how is it being deleted? Who's responsible? The verification processes, and like all those things need to be there. So if you're using a third party, you need to have documentation of that. Keep those documents of the fact that it was done. And on the topic of third party, you need to make sure your SaaS providers are doing the exact same thing. So they need to have a documentation that shows how they're providing an adequate guarantee that the data is being destroyed, right? Um, so that's how that all works. Oh, 52 minutes of very long-winded talking. So, um, does anybody have any questions?
Is it over?
Yeah, I'm sorry. That's a lot of
No,
information to run through.
I've done this before and I'm still like, wow, that's good. There's a lot of information. Yes, we will be sending out a copy of the recording and as well of the presentation. so that you guys can review it or forward it on to your friends. Our next session, part 2, this 3-part is managing PHIPA breaches, and that will be at, again, same time, 10 a.m., but this will be Tuesday, April 22nd. So next month. So if you have someone on your team that you think would benefit from that, feel free to invite them. The more the merrier. And in the interim, if you are like me and 5 minutes after we finish this, you have a question, my information is on the screen there, or I sent the email to you. Don't hesitate to reach out. Happy to assist in any way we can. So if there isn't any other questions, I think we can call it a day. Does anyone have any queries? I didn't either. So cool.
Looks like we've actually done pretty well answering questions as part of the document for once.
Yeah.
Usually there's a stream of them at the end.
Yeah.
So
Cool. All right. Well, thank you very much. And we look forward to seeing you guys all on Tuesday, April 22nd. So thanks so much for joining, and enjoy the rest of your Tuesday.
awesome. Thanks, everybody.
Bye.